Tibialis posterior muscle. The tibialis posterior muscle lies deep to the gastrocnemius and soleus muscles of the calf. This muscle primarily functions to guide the transmission of body weight through the proper bones of the foot. It is not typically active during the push-off phase of normal gait, but becomes active when the foot strikes the ground and becomes weight-bearing. Here are the landmarks for the tibialis posterior. First we have the tibia and the fibula, the interosseous membrane, and lastly the calcaneus or heel bone. The tib posterior originates on the interosseous membrane that stretches between the tibia and the fibula, and it inserts on the tendon of the navicular, cuneiform, cuboid, and metatarsal bones. Contraction of the tibialis posterior produces inversion of the foot, and it is also a weak plantar flexor. The tibialis anterior and the toe flexors assist the tibialis posterior during inversion, and the gastrocnemius and soleus are the major synergistic muscles during plantar flexion. The peronei oppose the tibialis posterior during inversion, and the tibialis anterior opposes the tib posterior during plantar flexion. Clinical findings for the tibialis posterior trigger point. Dr. Travell refers to this muscle as the runner's nemesis. Your clients may complain of severe pain in the sole of the foot and the Achilles tendon while walking or running, and the pain may migrate into the calf and heel regions. Some activating or perpetuating factors for the trigger point in the tibialis posterior muscle include running or walking on a sloping or uneven surface, eversion of the foot while walking or running due to poor shoes, a tendency to pronate the foot while they're walking, and hyperuricemia or gout conditions. The trigger points in the peroneal muscles are functionally associated with tibialis posterior trigger points. Some common misdiagnosis for active trigger points in the tibialis posterior muscle include posterior compartment syndrome, Achilles tendonitis, and shin splints. To locate and release the tibialis posterior trigger point, start with the client in the prone position and locate the crease in the back of the client's knee as your landmark. The tibialis posterior trigger point lies approximately 1/3 of the distance between the knee crease landmark and the origin of the Achilles tendon, and slightly medial to the midline of the calf. This trigger point refers pain primarily to the Achilles tendon and secondarily to the back of the calf and the heel region. Use a supported thumb contact to release the trigger point, holding the pressure for 8 seconds and repeating the release 4 times. Because the tibialis posterior trigger point lies deep to the gastrocnemius and soleus muscles, an elbow contact is often a more effective release technique than a thumb contact. With the client in the prone position, locate the crease of the knee, and then about 1/3 of the way down between the crease of the knee and the Achilles tendon, you'll find the tibialis posterior trigger point. Using a thumb over thumb contact, you're going to apply pressure straight down. Now remember, you're going to have to push the gastrocnemius out of the way a little bit because the tibialis posterior is deep to both the gastroc and the soleus muscles. Hold the pressure 6 to 8 seconds, and then repeat 4 to 5 times. Be sure to use client feedback here to gauge your pressure. As an alternate technique, usually more effective, again, locate your landmark, locate your trigger point, but this time use your elbow. Push the gastroc out of the way, and then apply pressure straight down and hold 4 to 6 seconds. Release and repeat 3 to 4 times.